Hi everyone, and welcome to Dr. Alec Decodes. I'm Dr. Draleknikolic, and I'll be taking a closer look at some of the more commonest questions that we get asked. One of the things that people are often concerned about are what are the possible side effects of dermal fillers. Now, thankfully, the majority of the side effects that we see with dermal fillers are minor and they are procedure related. And by that, I mean at the end of the day, we are using a needle at the end of the actual filler, and that needle is injected through the skin. And unfortunately, needles have the ability to cut. Even although it's a very, very fine needle, it can still, unfortunately, cut through a vein, and that will cause bleeding, and one will be able to see a bruise after the procedure. Unfortunately, bruises is quite a common side effect of dermal fillers. They're not dangerous, they don't affect the result, it's just that it can be unsightly. So the advice there is never book a dermal filler treatment before an important function or a business meeting or where you don't want to try and explain why there's a bruise. Now, the other procedure related and what we can expect following dermal fillers is a little bit of swelling. Some areas of the face swell more than others. For example, the lips, which are highly sensitive structures, will be a lot more swollen than, for example, if we treat the corner of the mouth or, for example, the cheek. Now, some people after filler have also reported fine little bruise marks, which we call petechia, and also some people have a slight degree of itchiness. Now, unfortunately, in those rare instances, we do have other less common side effects, but we, as doctors, we kind of don't like seeing them. The first, and this can happen with any injectable, anything that goes through the skin, one can introduce bacteria and cause an infection. The importance is to recognize it early and to treat with antibiotics before it turns into an abscess. And then also, and this is extremely rare, but inflammatory reactions against the filler have also been reported. Basically, it's how your body responds against the filler. And what happens is that forms quite a firm or a hard lump, which we call a granuloma. In most instances, granulomas can be treated with injectables, including things like Hyalase or even steroid injections. Now, also, which is not very commonly seen, is there is a potential, unfortunately, for the filler to be injected directly into what we call an end artery. An end artery is an artery that supplies a portion of skin, and if that artery is blocked with a little bit of the filler, there's no more blood supply, and that part of the skin becomes necrotic. It tends to die off. We call that vascular necrosis. Now, the importance here, very similar to the infection, is to recognize it early, because with a dissolving solution called Hyalase, if injected in time, it dissolves that filler and allows the blood supply to come back. Now, extremely rare, and unfortunately this has been reported, and in particular in certain areas of the face when treated, but blindness has happened with dermal fillers. The commonest areas where this has been reported is the nose, the forehead, as well as the injection or treatments within the temples. This is thought to be related to a certain degree to technique, but this is not always the case, and it's something that unfortunately, as a potential patient that is going to go and have a treatment, and in particular in those areas, you should be aware of. But as mentioned before, complications and side effects of fillers are thankfully really minor, and they are easily managed. Usually it's only the bruising and the swelling that we tend to see. I hope that has helped. Until next time, bye-bye.